as well as it's a specifically. Specifically, it's a observable, it's a measurable and specific. Specifically আমরা যখন কাজগুলো করি সেটাকে আমরা বিহেভিয়ার বলতে পারি। So an assessment approach, what about the assessment? Assessment is very interesting and very practicable. কতটা করছে, how much, এইটা জানতে হবে আমাদের। এইটুকু না জানতে পারলে আমরা বিহেভিয়ারটাকে অ্যাসেস আমরা জানতে পারবো না। So we can assess the behavior. An assessment approach that focuses on the interactions between situations and behaviors for the purpose of affecting behavioral changes. Please everyone mute yourself, please mute yourself, please. Okay.
Dr. Panigrahi sir, please unmute yourself. I have muted all others.
Sorry. Okay. Thank you, sir. An assessment approach that focuses on the interactions between situations and behavior for the purpose of effecting behavioral changes. Isn't it? Just we heard the first session. It's very interesting session. The interaction between situations and behaviors. This is environmental situations, behavioral situations. We always change ourselves. আমরা মাঝে মাঝে চেঞ্জ করে নি সিচুয়েশন অনুযায়ী, বিহেভিয়ার, এনভায়রনমেন্ট অনুযায়ী। সেই যে চেঞ্জিং প্রসেসটা, সেটাকে আমাকে অ্যাসেস করতে হবে। ইটস ভেরি অ্যাসেস করতে হবে যে কতটা পরিমাণ আমরা এই বিহেভিয়ারটাকে করছি। যদি if the history of behavior, it's a behaviorism beginning in 1930s. Pavlovian or classical conditioning, B.F. Skinner, you know everyone, 1953, Skinner box for rat learning research, operant conditioning, stimulation, you know everyone. Behavioral assessment context in clinical psychology grows from behavior theory, learning theory aspect of it can be easily combined with other from the essence assessment, very common to do so. Different from traditional assessment, you know. Functional behavior analysis. It's very important thing. It's functional behavior analysis. There is two models there, SORC model and another one is ABC model. S stimuli, O is organism, R is response, C is consequences. And ABC, you all know, A is antecedent, B is behavior, C is consequences. You know everyone. Any example? ABC, please unmute yourself and say any example or write your chat with chat box. ABC, antecedent, behavior and consequence. Any example, any type of example in normal or children with special needs, whatever, just you share. Anyone? ABC, antecedent, similar to situation, just I give you some clue, similar to situation, behavior similar to response, and consequences outcome. Anyone here?
Antecedent means sir the situation, before the behavior, what was the situation or what and the behavior is which happened, that consequence is after the behavior. The Consequence means response of the
Good.
environment, response of the other
Yes.
surrounding.
Right. Thank you. Any others? Anyone? Okay. So this is similar to situation, similar to response and outcome. It's very important thing. Behavioral assessment methods is a behavior interviews, observational method, a naturalistic method, controlled observation, controlled performance techniques, self-monitoring, role-playing, inventories, checklist, cognitive behavior assessment, etc. It's very important. Behavioral interviews. Interviews conducted for the purpose of identifying a problem behavior, the situational factor that maintain the behavior and the consequence that result from the behavior. Actually, behavior, there are two parts. First one is skilled behavior, another one is problem behavior. You know everyone. Number one is skilled behavior and another one is problem behavior. What about skill behavior? जस्ट हम लोगों को जो स्किल है उसको बढ़ाना चाहिए और थोड़ा सा चाहिए, जो है उसको और थोड़ा सा कंटिन्यू करना चाहिए. और प्रॉब्लम बिहेवियर, यू मस्ट आइडेंटिफाई द प्रॉब्लम बिहेवियर एंड मैनेजमेंट इट, यू मैनेज इट. दिस इज द प्रॉब्लम बिहेवियर. असेसमेंट इसीलिए करना चाहिए, स्किल बिहेवियर एंड प्रॉब्लम बिहेवियर. प्रॉब्लम बिहेवियर का क्या है? वर्तमान स्तर का जानकारी के लिए प्रेजेंट सिचुएशन क्या है एंड उसको आगे बढ़ाना चाहिए. सपोज वी नो IEP, इंडिविजुअलाइज्ड एजुकेशनल प्रोग्राम, एवरीवन वी नो एज अ रिहा प्रोफेशनल. तो IEP करने के लिए हम लोगों को करंट स्किल क्या है, करंट डेटा क्या है, करंट सिचुएशन क्या है, इसको जानना जरूरत है. तो उसके साथ ही हम लोगों जो उसका लैक्यूना है, वो लैक्यूना के लिए हम लोग दोबारा वो प्लान प्रोग्राम करेंगे, जे कैसे कैसे उसको बढ़ाना चाहिए. तो सो दैट बिहेवियर टेक्निक्स, बिहेवियर इंफॉर्मेशन, ऑब्जर्वेशन, डायरेक्ट ऑब्जर्वेशन, इनडायरेक्ट ऑब्जर्वेशन, ये सब कुछ ये बिहेवियर के साथ ही जाते हैं. तो असेसमेंट एब्सोल्युटली जरूरत है. तो हम लोगों को पास एज ए बिहेवियर प्रोफेशनल, एज ए रिहा प्रोफेशनल, हम लोगों को पास एक असेसमेंट टूल्स है, बहुत सारे टूल्स है. तो बेसिक गेमर टूल्स सब लोग जानते ही है. इंटेलेक्चुअल डिसेबिलिटी के बारे में आप लोगों को जानकारी है ही जरूर. तो बेसिक गेमर इज इंपॉर्टेंट स्किल फॉर यू. बेसिक गेमर इज इंपॉर्टेंट असेसमेंट टूल्स फॉर यू. I give you some example and research paper. I give you something. तो इसी के साथ ही बेसिक गेमर जो है, बेसिक गेमर के कैसे यूज करता है हम लोगों को जानकारी हो जाएगा. आई थिंक intellectual disability consisting a major share of permanent handicapping conditioning in young children. The persons are characterized by apprehension to being dull and slow, having slow rates of development since birth in all areas. The children with intellectual disability are engaged in self-injurious, aggressiveness, destructiveness, hyperactive behaviors, which makes them isolated not only from the community and family, but creates serious problems in their rearing practice as well as in their learning. Origin of such maladaptive behaviors is unknown, as it is child specific. Generally, aggressive behaviors are shown by the subject painful and frustrating experience. Before 1999, the causes of aggression may be to seek attention of others. Hill 1978, or deficit in social skill, Goldstein 1988, Kapman 1992. The children with aggressive behavior problem have poor social problem solving skill. They are more likely to respond aggressively than other children in social problem situation. There is also some evidence that children with mild mental retardation and concomitant behavior problems are more likely to respond aggressively to hypothetical social problems than children with mild mental retardation and no accompanying behavior problems. An exact cause of hyperactive behavior is also not known. Love, Siffer and Simmons, 1965. Bakers and Davenport, 1962, noted that hyperactive behaviors were self-stimulatory in character. Many times, children with intellectual disability show behaviors that the considered problematic because of the harm or inconvenience they cause others. Wrote by Professor Vishnupad Nando and Pinky Mondal, Jadavpur University. एक्चुअली यहाँ पे एक रिसर्च हुआ था बेसिक गेमर के लिए, उसमें 10 सैंपल लिया गया था. All the samples were differently able female children intellectual impaired from the rural habitat of West Bengal. The samples were in the group 7 to 14 years and studying in the class 1 to 4 in the mainstream school. All these 10 samples obtained resources facilities in the resource room of the school. Out of 10 samples, 3 are mild intellectually impairment, 2 are moderately intellectually impairment, and 5 are severely intellectually impairment. The intellectual impairment of the samples were diagnosed by the special educator by use basic MR tools. Already it's a basic MR tool, you know, all of you. So findings: when violent and destructive behaviors of the sample were considered, it was found that item number 11, 12, 13, 14, 16. When temper tantrum behavior were considered, it was found that the item number 20 were unknown among the samples were consideration. Other items were shown by the sample occasionally. When misbehavior with others were considered, it was noticed that item 21, 25, 27 were never shown by the sample under consideration. Other item is this domain were found among the selected respondents. When self-injurious behavior were considered, it was noticed that the item number 30, 34, 35 were never shown by the sample under consideration. Other behaviors domain were found among the sample, but item number 37 common to all selected samples. Regarding respective repetitive behavior, item number 41 is all almost universal. When odd behavior of the sample were considered, it was found that item number 52 were totally absent among the present samples, and item number 50 are almost universal to the sample under consideration. When hyperactivity behavior were considered, it was observed that all the samples shown all the items of hyperactivity behavior domain. When behaviors were considered, it was found that item number 61 are absent among the selected samples. Others behaviors are common among the samples under consideration. Regarding antisocial behavior, it was found that item number 63, 64, 66, 67, 68, 71, only item number 65, that is stealing behavior, is almost common among the selected samples. No sample shown item 75, fear of persons, and almost all the Sample shown fear animal. Most of the challenged children are unable to draw sufficient stimuli from the environment. Therefore, they stimulate themselves by using different means which are not socially approved. This socially unapproved behavior do not support the challenged behavior to achieve new learning. Therefore, modification of socially unapproved behavior is, is essential. Either new learning is not take place. Intellectually challenged children are unable to draw sufficient stimulation from the external environment and therefore they engage themselves in different types of self-stimulatory behavior. These are of different types and their intensity also different. Before modification, before modification of problem behavior of challenged learner professionally have to access the intellectually challenged child, including assessment of his her problem behavior. Basic aimer support a professional rehabilitation worker to access different types of problem behaviors of intellectually challenged as well as the children with other associate disorder like autism, cerebral palsy, ADHD, etc. In the present study, investigators access the modern problem behavior of 10 intellectual challenged children by using basic grammar. The assessment of the sample were done in their home and rural areas. From the assessment report, it was noticed that all the considered intellectual challenged children process different types of problem behavior during informal interaction with the parents. That investigators noticed that the present of the sample were not aware about the effect of problem behavior in the life of their child. The study makes the parents aware about their child's problem behavior as well as how these behavior hampered their child's new learning. Actually, I just uh, share with that particular paper. It's very interesting and informative paper. I share with you. For the basic gamer, we have the uh, very important tool with us as a rehab professional. So, behavioral interviews. Now, I say about behavioral interviews. How? Interviews conducted for the purpose of identifying a problem behavior, the situational factors that maintain the behavior and the consequent the result from the behavior. Actually, बिहेवियर इंटरव्यू ये आप लोगों को करना ही चाहिए, नहीं तो असेसमेंट नहीं होंगे. बिकॉज गोल क्या है ये आपको देखना चाहिए पहले. हेल्प फॉर द सजेस्टिंग द गोल, गेन जनरल पर्सपेक्टिव, प्रॉब्लम क्या है ये आपको देखना ही चाहिए. Behavioral interviews are used for the obtain a general picture of the presenting problem and of the particular situation to be maintaining the problematic behavior. तो पहले हम लोगों को जानकारी था स्किल बिहेवियर, उसके बाद प्रॉब्लम बिहेवियर. स्किल बिहेवियर के लिए हम लोगों को और भी बढ़ाना चाहिए एंड प्रॉब्लम बिहेवियर आपको देखना चाहिए एंड मैनेज करना चाहिए. तो एक्चुअली ये जो बिहेवियर का असेसमेंट होता है ये कैसे होता है, किस टाइम पर होता है, ये आप लोगों को जानकारी जरूरत है. एक्चुअली क्या है ना, ये तीनों टाइप का, तीनों सिस्टम है बिहेवियर का असेसमेंट करने के लिए. फर्स्ट ये है फर्स्ट टाइम you assess the behavior problem behavior or skill behavior, whatever you know. basic grammar का पार्ट 1 का स्किल बिहेवियर है, पार्ट 2 का प्रॉब्लम बिहेवियर है. तो तीनों धारा में ये चलते हैं. फर्स्ट, जब भी आपके पास कोई कैंडिडेट आया हुए करते थे तो उसके फर्स्ट टाइम आप उनको लिए एक बिहेवियर एसेस करना चाहिए फर्स्ट. आफ्टर दैट you may plan स्किल बिहेवियर को कैसे आगे बढ़ाना चाहिए, इसीलिए प्लान करना है, और प्रॉब्लम बिहेवियर को मैनेज करने के लिए थोड़ा सा प्लान कर लीजिए। उसके बाद 3 मंथ दीजिए ये सब कुछ के लिए। 3 मंथ के बाद और एक बार एसेस करना चाहिए, तो कितना रिड्यूस हुआ और स्किल बिहेवियर कितना बढ़ गया, ये आपको देखना चाहिए। एंड फाइनली आपको एक तो टारगेट है ना, जो 1 ईयर का टारगेट है, सपोज 1 ईयर टारगेट, सपोज 1 ईयर के टारगेट ले लीजिए, ये अच्छा रहेगा। तो 1 ईयर के बाद आपको फिर एक बार असेसमेंट करना चाहिए। आफ्टर 3 मंथ, एवरी 3 मंथ यू कैन असेस द बिहेवियर। देन फाइनली अंतिम में कार्यक्रम जब एंड हो जाते हैं, उसके बाद और एक बार असेसमेंट करना चाहिए, कितना परसेंटेज बिहेवियर डेवलप किया है, मैनेज हुआ है, और स्किल बिहेवियर कितना आप लोग उनका वो जो बच्चों लोगों को कितना बढ़ गया है। তো কতটা পরিমাণ বেড়েছে এটা যেমন জানা দরকার, ঠিক আমরা পার্সেন্টেজে দেখবো এটাকে 80%, 90%, 70% কত পার্সেন্টেজে বেড়েছে সেটা আমাদের জানা খুব দরকার। এইভাবে আমরা বিহেভিয়ারটাকে অ্যাসেসমেন্ট করতে পারি। আমরা এমনি একটা সাধারণ ভাষায় বলি, অ্যাজ উই নো, যে অ্যাজ ইউজুয়ালি we may use the normal behavior and abnormal behavior. Abnormal behavior basically is a maladaptive behavior. It's a observation is the most important part. The primary techniques of behavioral assessment is it often used to gain a better understanding of the frequency strength and of the problem behavior, as well as the factors are maintaining it, isn't it? Naturalistic condition behavior typically होम ऑब्जर्वेशन, स्कूल ऑब्जर्वेशन, हॉस्पिटल ऑब्जर्वेशन, ऐसे करके ही होते हैं। कंट्रोल कंडीशन, स्टिमुलेशन, तो अकॉर्डिंग टू एनवायरमेंट डिजाइन टू such that it is likely that the assessor will observe that target behavior or interactions. Control performance techniques, an assessment procedure in which the children place individual in carefully controlled performance situations and collect data on their performance behavior, their emotional reactions, and or various psychosociological indications. It's very important. Self-maintaining techniques, monitoring techniques, and observational techniques in which individuals observe and record their own behavior, thoughts, or emotions, including information on timing, frequency, intensity, and duration. Clients are asked to maintain behavior lags over some situation or time period, whatever. Role playing are techniques in which patients are reactive, direct to response, that way they would typically respond if they were in a given situation. According to situation, they change their behavior according to situation. Some example, suppose तो उनको पेरेंट को देखकर उनका बिहेवियर चेंज हो जाते हैं बच्चे का, है ना? तो रोल प्लेइंग समथिंग, बिहेवियर, चेंजिंग देयर बिहेवियर। बेनिफिट क्या होता है? द थेरेप्यूटिक सेंस इट्स प्रैक्टिस इन अ सेफ सेटिंग प्लस प्रोवाइड्स ऑनगोइंग असेसमेंट। ऑनगोइंग असेसमेंट जैसे मैंने बोला था पहले, तो एवरी 3 months you may assess themselves, and after finally you may assess also. It's very important. So many checklists is there. I have already cognitive behavior assessment and adaptive behavior also assessment. Adaptive behavior, and adaptive behavior measure is a specific comprehensive assessment of specific comprehensive assessment skill. It is important tool to eligibility consideration for students with intellectual disabilities and with the development of effective educational intervention and transition program. It's very important. Transition program. It's very important part. And another part is acquisition of adapting behavior skill can impact a person's daily life. প্রত্যেক দিনের যে জীবনযাত্রা, সেই জীবনযাত্রার মধ্যে এরকম একটা পরিস্থিতি কিন্তু ঘটে আমাদের ক্ষেত্রে। তো acquisition of adapting behavior skill can impact person's daily life and affect his or her ability to respond to particular situations or to the environment. Adaptive behavior skills are as important to a student's success as our academic skill also. Adaptive behavior is included as one of the areas requiring documentation or diagnosis of intellectual disability. Conceptualization of adaptive behavior, DSM-4, communication, social self-care, home living, functional academy, work, leisure time, health and safety, conceptual practical social skill we also observe. Adaptive behavior refers to the effectiveness of or degree with which individuals meet the standard or personal independence and social responsibility expected for age or cultural group. It's very important part for the personal independence. Adaptive behavior refers to the skills that people need to function independently at home, at school and in the community. ये सब कुछ आपको ऑब्जर्व करना चाहिए। ऑब्जर्वेशन के लिए ये एडेप्टिव बिहेवियर के जो ऑब्जर्वेशन है, ये ऑब्जर्वेशन बहुत जरूरी है आप लोगों को, क्योंकि इसका होम
पार्टिसिपेंट दाঁড়ান স্যার। হ্যাঁ স্যার পাচ্ছি। হ্যাঁ আচ্ছা মিট করা আছে। আমার নামটা এখানে পাচ্ছি তো। হ্যাঁ এটা তো হ্যাঁ তোমার মিউট করা নেই। আমি মিট করে দাও আমারটা। এই এখনো মিট হয়নি। হ্যাঁ মিট দাও। না মিট না কেটে দাও না।
Three major question is there. What type of decision is needed? Purpose of assessment के लिए क्या चाहिए हम लोगों को? And another one is what adaptive behavior domain need to evaluate it? Focusing or skill? Can the results be used to inform program planning and monitoring, selecting measurement tools? Three question is very important part for you. Anyone can share with a particular question. What type of decision is needed? Purpose of assessment. Anyone? Please unmute yourself and say something. Already I have told all the three questions. Anyone please? আমরা এই যে অ্যাসেসমেন্ট করব তার কি প্রয়োজনীয়তা আছে? ইজ ইট? সেটা কি? हम लोगों को जो असेसमेंट करना चाहिए ये नीड बेस्ड है कि नहीं? तो नीड बेस्ड होगा तो क्या?
It is needed. Assessment is very much needed because of the modification.
To check the requirement.
Yes, definitely. Any others?
It is needed to identify the problematic behavior, to resolve or to control or to reduce this behavior, and we should focus on the skilled behavior to enhance those behaviors.
Thank you so much. Any others?
স্যার
Yeah.
অ্যাসেসমেন্টটা খুবই প্রয়োজন, কারণ অ্যাসেসমেন্ট না হলে আমরা কোনো বাচ্চার কোনো করতে পারবো না আর কি, যে মানে প্রোগ্রেসটা এর মানে দরকার কোন জায়গাটাতে কি অ্যাসেসমেন্ট তার জন্য একটা অপরিহার্য জিনিস একটা।
বাহ।
Sir, assessment is needed for taking the first step to modify the behavior of the child.
Yes, absolutely.
Because
okay, thank you so much. Thank you so much.
Okay.
And another question is, what adaptive behavior domains need to evaluate? Focusing skill. Focusing skill.
Sir, can you repeat the question?
Yeah. What adaptive behavior? What about the adaptive behavior? First question is, what is adaptive behavior?
Panigrahi, sir.
Yeah.
Panigrahi, sir, one request.
Yes, sir.
From your mobile, can you make me host? Because my net was not there, so you have become host. Can you make me host from the from the participants?
Yeah.
From the participants, if you get my name.
Yes.
And in my name, there will be a mute or unmute option. By the right hand side, there is a more option.
Yeah, more option.
More option, please see. Make host.
Yes. Okay.
Make host. Please make me host.
Okay.
Yes, thank you.
Okay, sir.
Thank you.
Okay, sir. Okay. First question is, what about the adaptive behavior? Anyone can share?
Adaptive behavior are those behaviors which are needed in our daily life to lead a normal life in the society or community.
Exactly. Thank you. And now question is, what adaptive behavior domains need to be evaluated?
First of all, we should evaluate the self-help skills and the communication skills.
Good.
These are
independent behavior.
Independent behavior, independent living, right? Okay. Anyone? Any others?
Activities of daily living.
Yeah. Activities of daily living, right? Okay, thank you all of you. And another question is, can the result be used to inform program planning and monitoring? That is, I give you a cue, selecting measurement tools. As a rehab professional, you may select the particular tool for the assessment of behavior problem for your children. Which tool?
So checklists, role plays.
Yeah. Or
basic MR.
So formal tools.
Formal and informal tools is there. So which one is formal tools and which one is informal tools?
Sir, formal tools are standardized tools, which are used by clinical psychologists.
Yeah.
And informal tools are interviews and role plays and checklists on child behavior.
Yes. Thank you so much. So now, purpose of adaptive behavior assessment: to confirm or establish a diagnosis. It's very important. To determine if the child is eligible for special education services. How to determine this? Through assessment. To identify specific skills that need to be taught to the child for independent living. To determine the child's level of functioning in daily tasks required to the successful in the home, community, and workplace. To assist in transition planning. What is transition planning? Anyone can say?
Sir, it is like from problematic behavior to the desired behavior, whatever we plan.
Yes. Thank you. Any other system? Any other area other than behavior? What about transition planning? Suppose we shift academic to vocational.
Yes,
it is
sir.
Also transition. It is also
yes,
transition.
Sir, yes, sir. If the child is not under educable category, so we can shift the child to vocational category.
Yes. Thank you so much. Assist in transition planning and ensure the student has the necessary skill to be productive when he lives in school environment. It's very important to provide additional valuable information about generalization of skills across setting, home, school, community, isn't it? This is the program planning. To track and report progress of the child, to identity changes over time. Areas, skill, the examiner should focus on when doing the evaluation of adaptive behavior. Number one, anyone can say areas or skills the examiner should focus on when doing the evaluation of adaptive behavior. Anybody can say?
Self-help. Self-help.
Self-help. Okay. Yes. Number two.
Daily living activity.
Yes. Number three.
Expressive skills.
Yes. Number four.
And rehabilitation or earning a livelihood.
Right. Any other? Yes. Independent living, home living, caring for clothes, housekeeping, cleaning, maintenance, food preparation, cooking, etc. Social communication development, isn't it? It's very important. Communication development. Communication means interacting with others, talking, writing, using the phone, etc. Self-care, personal care, eating, dressing, hygiene, toileting, grooming, etc. Isn't it? Self-direction, making choice about how to use one's time, following the schedule, seeking assistance, deciding the new situation, adapting the new situation, isn't it? And practical academics, it is also important. Reading, writing, communication skill, time, community use, travel with community, shopping, etc. Leisure time also, it is also important. Leisure time, using available time when not working or in school, choosing age appropriate activity. Leisure time, employment, work related attitude and social behavior, completion of tasks, persist effort, health and safety also important. Making choice about what to eat, illness, identification of treatment, avoiding danger, relationship, etc. Approaches of adaptive behavior assessment. What about the approach? How many approaches there? Anyone? How many approach? This is indirect assessment and direct assessment. What is how can assess the indirectly? Is it possible? Is it? How can assess the indirectly
Yes,
assessment is possible? Yes. How?
Sir, role plays.
Role plays or any other?
Interviews.
Interviews. Whose? Interviews?
Like interviewing the parent and the child.
Interviewing the parents. So it's a third party reports from parents, teacher, caregivers, isn't it? This is the indirect assessment. Third party report, isn't it? Yes, direct and indirect approach, right? Direct approach is direct observation and task analysis, right, etc. People involved in the assessment, like examiner, maybe a specialized psychologist or guidance counselor, using a normal adaptive behavior assessing rating scale, isn't it? A number of people in the child's environment, parents, family members, caregivers, therapists, school personnel, community personnel. How is adaptive behavior data gathered? How? How is adaptive behavior data gathered?
Sir, it is important to fill the forms. Documentation is required.
Yes. Then after that?
Sir, after that, follow-up is required after every
extra. We also get the case history from their parents or their caregivers.
Yes, absolutely.
We study the case history and then we interview the parents and caregiver, and then we take in the whole history about the child.
That is observations of the child in real life everyday situation, isn't it?
Yeah.
Performance on task taking from the current program.
Yes.
Performance on task taking from the current program.
Yes, sir.
And interviews and checklists completed by those who work closely with the child on a regular basis.
Yes, sir.
Right. Steps of assessment. You know everyone, I think. So please say steps of assessment.
Sir, steps of assessment?
Yeah. First step?
First step is observation, and then documentation through case histories.
I think, ma'am, first step is meet the child to be assessed, isn't it?
Yes.
Yes, this is the first step. Am I right?
Yes, sir. Yes, sir.
Yeah. Then observation, isn't it? Okay. Number 3.
Sir, first
step is meet the child. Meet the child to the assess, isn't it?
Sir. Yes, sir.
Sir, it's not clear. It's not clear, sir. Can you repeat?
Yes, meet the child. Meet the child. First आप लोग मिले child के साथ, then तो assessment करेंगे ना?
Meet. Okay. Meet.
Yeah,
the
meet.
child. Okay.
Yes,
sir. Yes, sir.
Yes. Then observe the child in his natural environment.
Yes, sir. Yes.
It is very important. It is very important. It's natural environment. It's very, very important, isn't it?
Yes.
सोचिए कोई लोग होते हैं ना जे फर्स्ट टाइम वो कुछ भी नहीं करता है फर्स्ट डे के लिए, तो आप क्या करें? असेसमेंट कितने दिन के लिए होते हैं? सोचिए कोई चाइल्ड आपके पास आया फर्स्ट डे के लिए, तो उसका फियर हो गया, फोबिया हो गया, फियर हो गया, तो उसका असेसमेंट होगा क्या?
No, sir. Actually, rapport building session we missed on.
Yeah, absolutely. Rapport building session is necessary. देन तो आपको ऑब्जर्व करना है ना, तो रैपो बिल्डिंग सेशन नहीं होंगे तो ऑब्जर्वेशन नहीं होगा, प्रॉपर ऑब्जर्वेशन नहीं होगा। ऑब्जर्वेशन तो होगा ही, लेकिन प्रॉपर ऑब्जर्वेशन नहीं होगा, राइट? तो सो ऑब्जर्व द चाइल्ड, रैपो बिल्डिंग, ऑब्जर्व द चाइल्ड इन हिज नेचुरल एनवायरमेंट। सो नेचुरल एनवायरमेंट के लिए आपको क्या करना है? रैपो बिल्डअप करना है। तो इवैल्यूएट परफॉर्मेंस ऑन टारगेट स्किल लाइक ग्रूमिंग, एकेडमिक, etc. Evaluate using task analysis. Decide interview question, rating scale, checklist. Adaptive behavior assessment system like scale, independence behavior, so many system is there. तो आपको जो भी करना है वो उनको लेकर करना चाहिए। तो हम लोगों को पास क्या है? बेसिक गेमर है, तो बेसिक गेमर के लेके हम लोग जाते हैं, ठीक है ना? Finally, I can conclude now. Assessment of adaptive functioning is important for individuals within any diagnosis category. More and more assessing adaptive behavior has had broader applications. Different research has demonstrated that there appear to be different profile are various diagnosed group. And finally, determining how everyday life adaptive functioning is affected by nature or whatever, natural system, unnatural system, whatever, should be our goal. Research and clinical work has shown us how different systems are found in different groups. Program planning and assessment of changes after intervention are other goals of adaptive behavior assessment. Okay. With these few words, I conclude my session. If any question, any discussion, any addition, please say. Please unmute yourself and interact with me.
Thank you, Dr. Panigrahi. As usual, you've been very lucid, very clear, in very simple terms. You have made us understand what you're saying. Very good presentation. We'd love having you more.
Thank you, sir.
We'll give a break now.
Thank you, sir.
We'll resume at 1 o'clock, 2 o'clock. I'm sorry. We'll resume at 2 o'clock. Please join at least 5 minutes before the program for the third session. I have already given